Hi, this is Mark Adajar, one of the surgeons at Xsculpt, here in one of our Xsculpt operating rooms. And this video I wanted to do to show everybody how we plan on how to do a gynecomastia surgery. So we'll be doing a series of these now and then to show you how we actually plan to do the surgery and how we customize the procedure to the individual patient. You don't, just put somebody on the table and do the same surgery for everyone. We have to customize it to you. And this is our these videos are to help show our thought process in how we can customize the surgery to you. And for some examples, we have a whole bunch of videos of what the surgery looks like, but not so much about what the planning part of it. So we have our first patient right here, and let's get to it. So here we have one of our gynecomastia patients. All of identifying marks have been blocked. So as you can see, that this patient has a large volume gynecomastia, about stage 3-4. Okay, so you can't tell in the pictures, but this patient has very large underlying glands underneath his nipples on our initial consultation. So what we can see here is that he has a large amount of fat, in particular on the sides of his chest, which we have to address. So the way it starts out is during the day of surgery, we mark our patients, and what we want to do is we want to really accentuate the underlying pectoralis muscle. So for this patient, it's not completely accurate because I don't have the actual patient to feel, but we usually feel for the underlying pectoralis major muscle, the lateral border here, and then the inferior border, which is probably somewhere like right here, something like that. Okay. And then here on the side, we can probably guess it's probably somewhere around here. Okay, something like this. And then probably something like that. That's his underlying muscle. Okay, we're assuming, again, we're not. This is just a drawing. We actually want to feel it, but just for discussion's sake. Okay, so knowing that that's where we can tell his underlying muscle, what we want to do is we want to really accentuate that muscle, and the question is, how do we do that? Okay, so how we would address that is we would. First of all, we want to bring out the underlying, we want to really accentuate the lower and the lateral border to give a nice cosmetic look to that chest. So we would really want to address the fat at the lower half of this, of the chest wall here, and so all of this area, maybe a little bit higher here. All of this area would be removed. We would be aggressive liposuction here to remove the fat, and what that would do, it would create kind of like a little rise in the chest, and then a little drop down. We want to avoid areas over here because that may create a little bit of a dip or a flat chest, which we don't want. We want a pronounced chest. Now, in this particular case, we especially need to address this area. Okay, so we would, this area right here, so we would do liposuction of, aggressive liposuction here, okay, of this area here underneath the muscle, and then we would do a deep and superficial liposuction there, and then we would do liposuction of all this area, okay? And then on this picture, it would be over here. We would do like a deep liposuction there, deep liposuction here, and then I don't know how well it's projecting there, and then liposuction all of this, okay? And now this part is very important because if we don't liposuction this out, we really clean out all the fat in that area, we won't be able to see kind of like the corner of the chest here, of the underlying chest muscle here and the side of it, because we want to bring that out again. And so this will be ideally flat against the chest wall. Same with this, okay? Now, after we do liposuctions of all those areas, obviously it's important to remove the underlying gland, which is sitting behind the nipple around here, and that would be the last part of the surgery, to remove the gland so that the nipples won't protrude out when the rest of the chest flattens out, and so it won't look like a little ball underneath the nipple and have little bullet-shaped nipples, or they'll be really prominent while the rest of the chest flattens out. So now the question is, where do we do where are we going to make our incisions? So there are several choices here. For the gland itself, I'm going to use this nipple because it's not marked. But for this, we normally make a gland removal this is where we do the incision here. So it's hidden within the border there. Not on this picture, but maybe on this picture, it would be right here. Okay, if you can see that. I'm going to zoom it in as soon as we're done, so you can take a closer look of everything that we do. And those would be the incisions to remove the gland. Now, to remove the liposuction part, we can either do an incision here. And here, within the folds of the skin that you can't, so that when it heals, you won't be able to see it. Or we can do incisions here, right here in the armpit, right here. It'd be like that, there, and then probably an incision right here. Sometimes we use this one, sometimes we use this one, sometimes we have to use both, depending upon the angles, in order to make sure we get a good cosmetic result. I personally like using the incision of the axilla so you can't see it at all, but sometimes with this incision you may not get all the necessary angles to remove all the fat, and so if it's necessary to do this incision, we do that to get as much of the fat out as possible. Sometimes, and also depending upon when he's actually lying on the operating room table, sometimes I may not be able to get like the back right here, and so I may have to use this incision. It really depends upon how everything looks when he's laying on the table, with the priority being able to access all the areas. It would be a shame to make a small little incision in the armpit and kind of miss a whole area just for the sake of hiding a little 3 millimeter cut. And then all the stitches are all closed with usually we close the ones on the nipple with dissolving stitches, and these little 3 millimeter incisions, we put little very fine nylon sutures, which we usually remove at our first post-operative visit, and they heal without issue. All right, so for now, let me just, if you want to take a little closer look of the markings, if you want to see that, to see really how we plan the surgery in this particular patient. And again, every patient's a little bit different. Oh, and I forgot to mention, in this patient has, there's this fold here. If you can see this fold right here, there's a fold right here that, on his chest from the large volume and kind of like it's a kind of a skin fold, or, a fat fold. So part of the surgery is we want to release that so that when he stands up, he won't have that fold anymore. It won't be prominent. So during the surgery, we use the liposuction cannula, or sometimes even just maybe scissors or surgery instruments to just break up that line as much as possible. So it'll only be the muscle that you'll see here, and then just the flat skin as much as possible. It's very difficult sometimes to deal with the whole thing because it's very tethered to the underlying chest wall. But if we can accomplish that, it'll be a nice flat look without that kind of a roll. Okay, I hope you enjoyed our first preoperative planning video. If you want to see more, and if you like this, please subscribe and send us a comment below that you want to see more of this kind of stuff. Thank you so much for all your support on our channel, and of course of our surgery practice, to all of you who found us on YouTube, Instagram, and Facebook. All right, have a great day, guys. Bye.